Live from Wave in Louisville, Kentucky. This is Listens Live.
Welcome to Wave Listens Live. We've got a great show for you because we are live on site at Cornerstone Wellness Center. We've got Dr. Doug Kane to tell you all about his practice, his story, how he got started in this, and how it all started with somebody saving his life and then him dedicating his to helping others. Welcome to Listens Live. Dr. Kane, it is a pleasure to be here. You've been on set with me so many times, and it's the first time that we've been out here, so I feel like it's long overdue, but thank you for having us here today, and thank you for sharing your story with us on Wave Listens Live.
Hey, it's great to have you here. Welcome to our house.
Yeah. So I do want to get into that. I mentioned that in the open. Chiropractic, the whole industry is something that you care so deeply about because of the story of how you were involved in it in such an early age. Walk me through that, how that resulted in being here today. We're in New Albany, so how that resulted in opening this office and then you being able to help all the people that you've helped around Wave Country.
Absolutely. So it was September of 1983. I was 2 weeks into my sophomore year in high school, and I woke up with a terrible headache. Just not a normal headache, just fetal position kind of headache. What I didn't realize that day is I would have this headache unrelenting for the next 2.5 months. So we did all the over-the-counter stuff that you would think to do. Eventually went to the doctor. I was prescribed an opioid medication called Darvon 3 times a day. Didn't help. And then so they doubled the dose, and it still didn't work, so they doubled it a 3rd time. So at this point, I'm taking a dozen of these a day, and I am just drugged into oblivion. I'm failing school. I'm losing weight. All I wanted to do was sleep. I was falling asleep in class and on the school bus, and they thought at that point in time that I must have a brain tumor. So I'm just old enough that back then MRI was not widely available. So as a last resort, Mom took me to a chiropractor to see if it might be something else. Now, my mom, her mindset was chiropractors were for adults and it was for low back pain, not for kids with headaches. But she took me to a gentleman in Washington, Indiana, where I grew up by the name of Marvin Wooster, and he took x-rays, he did a physical exam. He was actually the first doctor to ever actually touch my back or neck and think that this might have been a musculoskeletal problem. He took x-rays after doing an exam and went over those x-rays with me, much like we do here today. And he said, you know, touched behind my other ear, my right ear, and he said, your headaches are coming from right there, aren't they? And he was right. And then so he gave me a chiropractic adjustment, a cervical adjustment on the spine, which we'll demonstrate here in just a moment. And just that instant, my headache was gone. And I thought, this is the coolest thing ever. I've got to do this. I'm so grateful for that headache because as a 15-year-old, I knew that moment why God put me on this earth, and this is my purpose, is to help people in a natural, holistic way of helping to restore their health and eliminate pain.
And your goal is for everybody that comes in here asking for that same level of help, that they can feel that passion that you have, the gratitude that you have for the chiropractors in your life that have gotten to you where you are today.
Absolutely. That's why we do what we do, and we want to treat everybody like family. I'll take care of you like you're my brother or someone like they're my mom or my sister.
And you've also got the story of your mom that I'm sure we'll talk about here in the second segment when we get into neuropathy and how that has gotten you a lot of success in the neuropathy reversal. But I do want to get back into the adjustment that you were just talking about. You talk about treating patients like family. You must, because you've got them willing to do this stuff on camera. Tell us who you got with us today.
TV. Yeah, this is Steve. I'm going to have Steve come on up here. He's like one of our neuropathy patients. And for our neuropathy patients that do have a back pain aspect of their condition, we will actually use chiropractic as an adjunct for that. So that doesn't necessarily apply to everybody. So if you're somebody who you feel like maybe chiropractic's not for you, that's okay. We can still approach your neuropathy reversal without this being part of your care. But for Steve, it is. So Steve, I'm going to have you come on up here right now.
So just walk me through the process here, you know, start to finish. What's your thought process? What are you looking for?
So Steve's been an established patient for several weeks here. I believe he's about 8 weeks into his treatment. Have you come on down here, Steve? And so what we're going to be doing, when we're dealing with neuropathy, it usually shows up in people's feet because, as I've said before, it's the farthest away from the heart. And so low back pain is the second most common reason to see a primary care provider after the common cold. So about 80% of the population is going to have some issue. So with our neuropathy patients, we want to make sure all those nerves from the brain can communicate down through the spine, through the low back, and can control that healing process all the way down to the feet. So what I will typically do, again, he's been established for a while, so I know exactly what's going on with him. This would be a little more thorough with a very first adjustment on somebody after we've done exam and x-rays. But I've already seen Steve's x-rays, and I know what's going on. So take a big deep breath in and exhale. There we go. And I'm just doing some good general range of motion here through the thoracic spine area here. He's in pretty good shape here. We also want to, with people that have issues with the neck, the nerves from the neck go down to the arms, hands, and fingers. And so we just kind of want to decompress that area here. So just a nice deep stretch from side to side. And then we're going to address the lower back here. I've already done an assessment on Steve, so I know which way I need to adjust which bones of the pelvis. So Steve, I'm going to have you on your side with this side up facing me over here. So this is a way we can adjust the vertebra of the lower back as well as the joints in the hips and pelvis called the SI or sacroiliac joints, and that's one of the common areas to have issues in the lower back. And same thing on the other side there, Steve. So it looks like I'm doing the same thing, but actually my contact hand is going in a different direction. It'd be like standing away watching somebody play the piano. It looks like they're doing the same thing, but there's different keys. And there we go. All right, now have you lie on your back there, Steve. Now, for this adjustment here, this is the one that actually changed my life because I had some issues where I had misalignment in my upper cervical spine, pinching nerves that went up my scalp. And with Steve's nice haircut here, I can demonstrate exactly where that nerve goes very well. And just nice breath and relax. There we go. And it's just nice and gentle. There we go. And have you come on up there to the end of the table.
When you start getting into adjustments up there, you have to be extra careful. I'm sure. How are you able to assure people that all this stuff it's good, safe, and it's all for the best wellness that they have?
So 35 years of experience, number one. But yeah, people ask me, it's like, weren't you scared to do that the very first time? And it's like, that felt like the most natural thing to me ever is to adjust the spine. Again, that kind of goes back to this is my purpose in being in this planet. So yeah, it's very, very safe, very gentle. Big breath and exhale. And again, just good general range of motion here in the spinal area. All right, maybe come on up, Steve. And thanks for your participation. So that's what a chiropractic spinal adjustment or a spinal manipulation looks like.
And then, well, obviously, yes, thank you for the willing participant to be able to walk us through that. But every time you're doing something like that and you think about the end result, how much more does that make what you do worth it?
So, yeah, it's wonderful. But honestly, and this is kind of the sad thing, after 35 years of doing this, that's what I expect. I expect these results because we're used to seeing it for so long. So when somebody comes in here for help, that's my expectation that we're going to be able to get them better and head them in the right direction. Does it work 100% of the time? No. But in those cases, I can refer to the proper healthcare provider that will help them and get them that last stretch of their journey.
MyDrKane.com. You can also call or text the number on the screen, 812-949-0900. Make sure you're getting all your questions answered. We're here in New Albany. Make sure you visit Dr. Kane. If anything he says makes you think you might be able to benefit. We got 2 more segments left with Dr. Kane. We're talking neuropathy in the next one. So stick around. We'll see you when we get back here after the break.